My name is Dr. Olivia Thredson. I'm going to be your psychiatrist for today. We will be analyzing your psyche, maybe going into some Freudian themes. I don't know. What is it exactly that you feel like you're having a problem with? Determined based on that, I'll be able to help you. Any sort of psychosis, perchance of you seeing any aliens, in order to, allow your mind to kind of ignore the fact that you slaughtered your wife. Or by chance, are you experiencing any homosexual feelings or thoughts? So there's not going to be any use for Bernardo then. Shame. Anyways, in that case, what is it exactly that you're going to be needing help with today? Cannibalism by chance? Are you a cannibal? Not there yet. Okay. Interesting. Now, no, of course I'm not going to curtail that behavior. I mean, I'll deal with it when it comes, but I mean, why deal with something that's not even a problem yet? You know what I'm saying? Excellent. Anyways, what is it exactly that you feel like you need help with? I see. You're experiencing the, Lolita complex. The whole baby girl daddy kink. Were you by chance thrown into the system at a young age, an orphanage, dropped off in an orphanage as a baby, having to grow up around children with inferior intelligence compared to you, deprived of the human touch and any tender affection that anyone could possibly, even a hand on the shoulder. The nuns were quite cold. Anyways, did you experience anything of that nature by chance? Anything that, might have made you very sensitive to human contact? By chance, any sort of trauma where you are now wanting some sort of father figure in your life, or a mother figure in your life, or anything of that sort? Have you decided to go to medical school and examine cadavers and, try and use them for your needs, such as holding a cadaver, having a cadaver hold you back like a mother would its child and whatnot? Yes, I am a psychiatrist. I went to medical school. Anyways, are any of these symptoms applicable to you? No. Okay. So you just have the daddy. Okay. Yes, that is truly a grave and serious mental issue. We will be needing to further analyze that, because that's just unless you're talking like Johnny Depp back when he was in his 40s, it's just no. Anyways, let me just pull up a fresh new profile on you. May I have your name, please? Yeah, that is not your name. Lolita is not your name. What is it's not Dolores either. What is your name? Oh, wait. Okay, thank you. My handwriting's chicken scratch. Excuse you. Chicken scratch, chicken scratch, chicken scratch. And may I have your birth year, please? Let's not lie now. Let's have your birth year. You are clearly above the age of 18. What is your birth year? Thank you. Yeah, if you were beneath the age of 18, that would be a very serious concern. I would probably have to advise, or rather warn your teachers of the fact, and have any sort of authority present within the school system made aware of the fact that you are having these sort of intentions, and to pay more attention to the behavior between you and your teachers. But it's a good thing that you're still in the school system. You're above the age of 18. Okay. It's fine. You're above the age of... It's fine. Okay. Never too late to get an education. It's fine. It says here, if I calculate those, though, you're like 24 years old. What grade are you in? Freshman? What made you exactly, get held back so much? You realized your life dream was to be a freshman in high school, a 14-year-old. Well, I mean, you can't be 14 years old forever. I mean, like, you're not even 14 years old now. You're just a 23, 24-year-old in freshman in high school. So, good job pursuing your dreams. Now, may I have your, I was gonna say occupation, student. Okay. And of course, I was gonna ask for parental, signatures and whatnot. But since you are above the age of 18, we can just get that formality out of the way towards the end and whatnot, because you are the one coming to see me and whatnot. So, anyways, what is it that you like to do for fun? You like to look at outfits on Pinterest about how you can better dress like Lolita from Lolita. Okay. Are you talking about the 1964 version or the 1997 version? 97. Okay. I like the 64 version just because it was directed by Kubrick and it has Peter Sellers, but aesthetically, the 1997 one is just so beautiful. But once again, it's just a movie, so there's no need to live your life by it as if it were like, I don't know, some sort of, book that everyone just decided to listen to. Now, yeah, that's weird though. I mean, like, Lolita's a book though. And like, you're living your life religiously by it. Anyways. So around when did you feel like these symptoms were starting up? Around the age of 17. Okay. So around the point where you realized that you were no longer going to be like a teenager and like, young, you were actually going to grow up. Okay. Like the Peter Pan sort of effect where it's like, oh my god, I'm going to become an adult one day, but I want to be a kid forever. Yeah, okay. You don't happen to believe in fairies, right? Yeah, Sir Arthur Conan Doyle actually believed in fairies, despite being such an intelligent man. I mean, he came up with the Sherlock Holmes series, but he for reals believed in fairies. So I just needed to make sure. Okay. And you don't by chance, like, killing people and skinning them and then using their skin for lampshades and, their skulls for candy holders and using their flesh for couch pillows and whatnot, and skinning them and making them into a mask and using their teeth for the mask and for other little knickknacks around the house, and not your... Okay. Well, alrighty then. There's no need for judgment. Why do you look so judgmental? Thank you. Tone down the attitude. There we go. Alrighty then. But I must say, here, let me just... Your skin looks fabulous, to be honest. Do you use Clean and Clear? Oh my god. Do you wash your face and then use moisturizer afterwards? At least once a day. Oh my god, because it looks truly fabulous. Like, do you drink water? Like the full 8 cups of water a day? Because, I mean, your skin looks quite flawless. I mean, like, if someone were to just skin you, it's just... Imagine how soft that pillow would feel. It would feel so smooth. Oh, your complexion is just to skin for. Oh, so soft. It's just so soft. So soft. I know. It's normal for a psychiatrist to feel the face of their patient. I mean, like, how am I supposed to identify you? Smooth skin. And, how long exactly have you been moisturizing and drinking water? Since you were 17. Interesting. Is it because you want to keep your youthful looks? Because you want to pass off as a 14-year-old as much as possible? Interesting. Have you been considering getting plastic surgery by chance? You've never had plastic surgery, but you... Okay, let me just write that down. Never had plastic surgery, but would consider it. Okay. Well, let's hope you don't get surgery then. It's always nice to just have a fresh, clean palette to work Once again, just identifying you. Now, can you, like, show your teeth? Yeah, just like this. Just show all of them. What a nice set of teeth. That's, your dentist must be proud. Regular visits? I can tell. Do you floss? No blood, then. Excellent. This is truly, we're gonna do well together. I can tell. Here we go. Okay. And, have you by chance acted upon these fantasies you've been having, these wants you've been... Okay. Well, considering how you are above the age, it wouldn't be considered criminal activity if the target were to reciprocate your feelings. However, that would be incredibly repulsive considering the maturity gap between you and an older man, but considering how an older man that might be considered a May-December relationship reciprocating your feelings and actively pursuing you at such a young and, considering your mental health, vulnerable age, it would indicate his own lack of consideration on his part, thus lack of maturity. And I guess you would be the same level of maturity. But once again, it is disgusting to have some aged man after you when they're so close to death and you've just begun life. Like, get your hands off me, you eventual corpse. Anyways, let me just write down these little notes. Just jot down your psychiatric portfolio. That way we have everything documented. There we go. And, here. It's just so soft. What moisturizer do you use? I think I might start using that too. Wow, okay. And how much is it priced? Well, on my salary, I am a psychiatrist. I do make quite a good living. And I do sell cadavers to the medical community, and I do work with them at times. So I do supplement my income with even more income, so it's not like a pricey moisturizer isn't too far out of my grasp, especially since it is for my hobbies. Excuse me, hello, beauty care, it's my hobby. Can't you tell? Now, what dentist do you visit? The dentist's name, please. And I assume he's from an accredited university and he has all of his required paperwork, experience. I can tell that the work he does is quite amazing. It's just when I recommend people to him, I want to make sure that they also don't find any fault in him. Because it's not like I can rip your teeth out of your mouth and show them the work he does. No. Isn't it? Great. There we go. There we go. I think we might have finished your profile. Now, is there anything else you would like to say to me before the screening is done? Did I say screaming or screening? Screening. Before the screening is done. Okay. Let me just jot that down then. In that case, you're all set. Let's schedule the next appointment. Will you be able to see me this evening in the same location, in that same seat? You enjoy the material the seat is made out of? I made it myself. It is one of my hobbies. Yes, I will tell you all about it. In fact, I'll even show you how it's made once you return in the evening. Great, great. And also I'm going to be getting a new couch tomorrow, so it's maybe I can, put my best efforts to put you in that seat as well. How would you like that? Right, great. A fellow appreciator of furniture. Lovely to meet you and can't wait to work with you.